The process is to see what the disease is, what the pathology, and to see what needs to be delivered, but to know the patient well and to understand what are the health problems people have, not only physical issues, but sometimes it's even dynamic of the family and how comfortable the patients are, how much support they have from their loved ones. Or the primary goal is always a patient, and I'm guided by the patient to, let's say, how much information I provide to the other people, even to that degree. Then looking into various blood tests, various investigations. I'm not happy to progress with the surgery until I have the entire picture of the patient. I need to have, for heart surgery, always coronary angiogram, the heart ultrasound, which we call echocardiogram, the appropriate blood tests. I need to know how the coagulation profile is, so how well the blood may clot, or whether it's thin enough. For some operations we need to operate on people with the blood thinness. We need to be prepared if there is a higher risk of bleeding, and that's an important thing, what the liver function, what the kidney function, how much they function in the family and outside of operating theater, and what their expectations are. So it's a lot of things need to be put up into the final decision, what to do, how to do it, and when to do it. And that's the only way to go. I certainly don't try to rush to concentrate on doing the bypass grafts on this patient. I need to understand what is the best way to protect the other systems of the patient. If the patients are hypertensive, or if they're with diabetes, I involve the other specialists to provide the entire care. You don't want to miss any particular part or particular, let's say, disease or pathology of the patient, and just concentrate only on your surgical thing. In a way, every patient is a complex entity, and that's how I see that should be seen, and that's how I see my patients, to avoid problems really.